Medical Coding by Jen. Today we are going to discuss and work on practice questions for HIPAA. Thank you for watching. I hope this information is helpful. I like to help others pass their medical coding certification exams from the exam point of view. Remember, for more helpful information, visit my website at medicalcodingbyjen.com. Let's get started. The need for privacy and security. In healthcare, protecting patient information is not just a good practice, it's the law. The Health Insurance Portability and Accountability Act, or HIPAA, provides federal protections for patients' health information. These protections apply to entities that handle health information, also known as covered entities. Let's take a look at who these covered entities include. Healthcare providers, doctors, clinics, psychologists, dentists, chiropractors, nursing homes, and pharmacies all fall under this category. This includes health insurance companies, health maintenance organizations, HMOs, company health plans, and government programs that pay for health care like Medicare, Medicaid, and military or veterans health care programs. Healthcare clearinghouses. These entities process non-standard health information they receive from another entity into a standard format or vice versa. One key rule of HIPAA is the minimum necessary requirement. This means that only the minimum amount of protected health information phi needed to accomplish a purpose should be shared. If certain information isn't necessary, it should be kept private. This helps protect patient privacy and ensures that sensitive information is only shared when absolutely needed. A healthcare provider needs information to treat a patient. The patient themselves requests their information. The patient gives permission for the information to be used or shared. The information is needed to comply with HIPAA rules. The information is needed for enforcement purposes by the U.S. Department of Health and Human Services. Other laws require the information to be shared. To comply with HIPAA, each covered entity must develop policies and procedures that fit their specific needs. Only those individuals whose jobs require access to PHI should be allowed to view it. This helps maintain patient confidentiality and security. I hope you are enjoying this content and find this information helpful. Stick around till the end and we will do practice questions for your medical coding certification exams too. Thank you for liking, sharing, and commenting on my content to help motivate me to create more content. HITECH and its impact on HIPAA. In 2009, the Health Information Technology for Economic and Clinical Health Act, or HITECH, was introduced as part of the American Recovery and Reinvestment Act. HITECH builds on HIPAA by addressing privacy and security concerns associated with the electronic transmission of health information. One of the major changes HITECH brought about is that patients can now request an audit trail of who has accessed their electronic health information. This adds an extra layer of transparency and security. HITECH also requires that patients be notified if there is an unauthorized disclosure or use of their health information. This means that if your health information is accidentally shared or accessed without permission, you have the right to know about it. Understanding ethical dilemmas and reducing liability. I hope you've been taking notes. We are going to need to add notes in our exam manuals for our open book exam later. In healthcare, ethical dilemmas are situations where the right course of action isn't always clear. Medical professionals must balance their duties to patients, the law, and ethical standards. This means making decisions that are in the best interest of the patient while also respecting privacy and following legal guidelines. Negligence and malpractice are terms used to describe situations where a healthcare provider fails to provide the standard of care, leading to harm or injury to a patient. It's crucial for healthcare providers to follow established protocols and procedures to avoid these situations. Here are some ways to reduce liability and ensure ethical practice. Adhere to privacy and security standards. Always follow HIPAA and HITECH guidelines. Ensure that only the necessary information is shared and that it is protected from unauthorized access. Maintain accurate and complete records. Proper documentation helps provide a clear picture of the patient's care and can protect against claims of negligence or malpractice. Ongoing education, stay updated on the latest laws, regulations, and best practices. This helps ensure that your knowledge is current and that you are providing the best care possible. Clear communication. Always communicate clearly with patients and other healthcare professionals. Make sure that patients understand their treatment options and that their consent is obtained for any procedures. Ethical decision making. Use ethical guidelines to make decisions that are in the best interest of the patient. This includes respecting patient autonomy and confidentiality. Okay, we're going to go over some practice exam questions related to HIPAA and healthcare coding. These questions are great for testing your knowledge and preparing for certification exams. So let's dive right in, and I'll guide you through the questions, the correct answers, and the reasoning behind each choice. Ready? Let's get started. Question 1. Which one is not a covered entity of HIPAA? A. Medicare. B. Workers' compensation. C. Dentists. D. Pharmacies. The correct answer is B. Workers' compensation. Rationale: covered entities under HIPAA include healthcare providers like doctors, dentists, and pharmacies, health plans such as Medicare, and healthcare clearinghouses. Workers' compensation is not considered a covered entity under HIPAA because it's a type of insurance program rather than a health plan. HIPAA's main focus is on protecting patient health information within healthcare and health plan settings, not on occupational insurance programs. Are you ready for another practice question? An entity that processes non-standard health information they receive from another entity into a standard format is considered what? A. Billing company. B. Electronic health record vendor. C. Clearinghouse. D. Practice management vendor. Answer: the correct answer is C. Clearinghouse. A clearinghouse is a type of covered entity under HIPAA that processes non-standard health information received from another entity into a standard format, and vice versa. Clearinghouses act as intermediaries between healthcare providers and payers, ensuring that information is correctly formatted and transmitted for billing and reimbursement purposes. While billing companies, EHR vendors, and practice management vendors handle health information, they don't specifically perform the function of converting data formats like clearinghouses do. Okay, did everyone get the last two correct? Ready to try more? What is PHI? A. Personal history information. B. Problem with history of infection. C. Partial health interaction. D. Protected health information. The correct answer is D. Protected health information. PHI stands for Protected Health Information, which refers to any information in a medical record that can be used to identify an individual and was created, used, or disclosed in the course of providing a healthcare service, such as diagnosis or treatment. Examples of PHI include patient names, medical records, insurance information, and other personal health details. Understanding what constitutes PHI is crucial for maintaining privacy and security in healthcare settings as required by HIPAA regulations. I hope you found this practice session helpful. For more helpful tips, information, and practice questions, be sure to visit my website at medicalcodingbyjen.com. If you enjoyed this video, don't forget to like, comment, and share it with your friends. Stay tuned for more educational content and keep up the great work on your journey to becoming a healthcare coding expert. Great job, everyone. Going through practice questions like these helps you solidify your understanding of key concepts in healthcare and prepares you for real-world applications. Remember, knowing the correct answers and the reasoning behind them is essential, especially when it comes to protecting patient information and complying with regulations.